we know, elders are disproportionately affected by COVID-19 in terms of their impact on their health, with estimated mortality rates higher for all Nevadans ages 50 and older. Simply put, elders need to stay home for the foreseeable future. Directly alongside the public health, healthcare, and financial crises of the coronavirus pandemic sits a senior services crisis that has the potential to negatively impact all older Nevadans. But thanks to a collaborative effort with the Aging and Disability Services Division, the University of Nevada, Reno, the Sanford Center for Aging, and Nevada Senior Services in Las Vegas, they have mobilized a rapid response effort known as Nevada COVID-19 Aging Network, or for short, Nevada CAN. Here's how.
Hi, my name is Dina Schmidt, and I am the Administrator for Aging and Disability Services for the state of Nevada. A senior can go online and request help, and then that request will go to a team of our staff at Aging and Disability Services. They will triage it and send the referral out to the appropriate action team. Our action teams are focused in 4 areas. So we have the telehealth and access to telemedicine. That group will work with the senior to identify what their medical needs are, if it can be done via telehealth, if they will coordinate with their current telehealth provider. If their provider doesn't have the capacity for telehealth, then the universities have that ability and will take on that service and provide it. The second group we're focused on is really our community connections and social services. So this is a group of volunteers working to make sure seniors have the connections that they need, whether they want to volunteer to help one another or if they want to receive a check-in call, a weekly, daily check-in call, whatever they would like and need, we would be able to accommodate that either through our own volunteer groups or many of the organizations that already exist throughout the state. And then the third area of focus is really on that nutrition and medication. So that group will be focused on making sure that people have the nutrition needs met as well as any prescriptions delivered to them as needed.
Hi, my name is Jennifer Carson, and I'm Director of the Dementia Engagement, Education, and Research Program at the University of Nevada, Reno. So what we envision for Nevada CAN is a website that is accessible to not just all elders across the state of Nevada, but any concerned citizen can log on to Nevada CAN and connect with important information. And there's also a portal where anyone can complete an online application that communicates an elder's essential needs and their interests in receiving additional support. And so this is a really simple online form that an elder or someone who is supporting that elder can complete, and it identifies what their needs are. Those needs, that form then goes to case managers with Aging and Disability Services Division, and they triage those needs to one of 3 different action teams. And so one action team is really about the mobilization of food and medications to the front porches of elders across the state. And that action team is really going to be seeking volunteers to help us build capacity at the county level for the very important work that county senior service agencies are already doing.
Hi, my name is Peter Reed, and I'm the director of the Sanford Center for Aging at the University of Nevada, Reno School of Medicine. There are community-based aging service providers around the state who for decades have worked to ensure that vulnerable, many times low-income elders have the resources that they need to live well in the community. And suddenly, with all elders, all seniors, being asked to stay at home, being highly encouraged, being required to stay home to reduce their risk of exposure to COVID-19, there's the potential for all of Nevada's elders to become socially isolated, to not have the basic needs of everyday life, and to have limited access to medical and health-related resources that they would otherwise be able to travel out to access. So we're launching the Telehealth Action Team to mobilize an integrated response to ensure that while they stay at home and stay safe from exposure to COVID-19, elders are also able to access medical services, social work services, and other healthcare related opportunities to get them what they need to help them to stay well.
We know that there's over 450,000 seniors now that are in isolation, and we want to do everything that we can to make sure that they're able to stay at home safe and sound and get their needs met. So this is our attempt to get information to them. an easy way for them to reach out and ask for help. So there's many people that have never had to ask for help before, and so this is new for them, and so we wanted to make it really simple, an online way to request information or help, and then we will triage that and get it out to our community partners in the network. And so the Aging Network is statewide and very vast, and so we can help coordinate those efforts with those providers.
So volunteers can join Nevada Can by logging onto our website. There's also a portal for volunteers, and we are actively recruiting.
The mobilization of all of the county and local community-based service providers are coming together to rapidly address this aging services crisis that we now find ourselves in. And it did happen very quickly. I would say we put the whole plan together and in place and in action with a launch within 10 days to 2 weeks.
Nevada can and we will, working together, we are going to make it through this pandemic.
Such an amazing collaborative effort. I'm so thankful for what they're doing in a really short amount of time for our seniors. Please do not be afraid to reach out and see how they can help you. Or if you want to volunteer, head to nevada211.org or simply dial 211.